Very good evening, friends. Meeting again in the Materia Medica session, and today we're going to learn one more very useful remedy in our homeopathic practice, that is Carduus Mar. Carduus Mar is the remedy which I have used a number of times. It is a very important remedy for liver pathologies, specifically when liver is at failure, liver cirrhosis is there. Even in some cases of liver cancer, Carduus Mar is a very important remedy. I have used it whenever there is a problem with the liver, specifically the left lobe is affected with cirrhosis with associated with ascites. Abdomen is fully bloated, full of fluid, and patient becomes little bit despondent, disturbed, hopeless, and he feels that there are very less chances of getting recovery. Then this remedy works beautifully. There was one patient who was police at the age of 52. He suffered with the liver cirrhosis, with ascites, tapped a number of times, and he was in a very depressed mood. Fully bloated abdomen was there, and just 2 days back before coming to me, he was tapped, and the doctor said now there will be, I will not going to do a tapping because it may affect his life also, and that's why they refused. This fellow came to me right from 200 to 50 kilometers away from my place, and they came and they asked whether homeopathy will work for it, and he was there. The whole body was swollen, full of fluid over there. And when I started examining, there was a very tender abdomen, and he was not able, I'm not able to palpate properly because whenever I used to palpate, he used to have a pain. Specifically, it was in the epigastric region, the pain was very marked. He used to vomit a lot, yellowish vomiting, and he has become absolutely despondent. That was the word which was very important in that patient. Asked many things. He was alcoholic, chronic alcoholic. Being a policeman, he used to remain away from his place and used to remain over there. And there he had a habit of taking the alcohol, and he suffered from the cirrhosis. And now, being hopeless, that hopelessness was seen on his face. So I took whole history, and it was typical of the Carduus Mar symptoms were there. So I have started him on Carduus Mar, mother tincture. His complete history denoted the lycopodium over there. So few doses of constitutional lycopodium followed by the Carduus Mar in mother tincture, and I have continued it. I asked him to meet me after 15 days. And when he came after 15 days, there was a pendulous abdomen. I asked whether, have you tapped anymore? He said, no. But doctor, this has happened. And abdomen was absolutely looking like pendulous because whole fluid, ascitic fluid has been drained away. And that is the wonderful action of the Carduus Mar. He recovered from that condition, then he joined the duty again, and he was under the treatment for 3 years and without any problem. He left the treatment. Again, after 1 year, he again started drinking alcohol and suffered from the same. So this is very important remedy, specifically in liver cirrhosis. For second thing, which I have used with successfully in the gallstone colics. It always goes with the urine. It is always drained with the urine. That is the thing. Whenever ascites is recovered, it is always drained through the urine. So, in
Sir,
gallstone
one
colic,
question, sir. Please.
at the end, I will discuss. In gallstones, patient had a very severe pain associated with the pain in tenderness in left side of the liver or left lobe of the liver, and jaundice skin. This remedy is again one of the important remedy one should not forget. If you'll go through the Murphy's notes, he has given very nicely the illustration of this remedy as a, it is a remedy as a liver tonic. He explained that there are many remedies which we can discuss. Cratagus is a heart tonic. The spleen tonic is the cyanothus. Then he has said renal tonic is equisetum. It means they are having very specific action on that specific area, and where they gives the strength to that specific organ. So this is a very important remedy in our practice, and many times we came across with cases of liver cirrhosis with the gallstones. This is a good remedy to be think of. Open your Boericke Medica. It is called as Carduus Marianus, St. Mary's Thistle. This is the common name. The action of this drug is centered in the liver and the portal system, causing soreness, pain, and jaundice. Has specific relation to the vascular system. Abuse of alcoholic beverages, especially beer, varicose veins, and ulcers. So, see, center of action is liver, center of action is over there in case of alcoholic, specifically the liver, the portal system, the portal congestion. This is very important remedy. Second, this is a remedy for disease of minors associated with asthma, like pothos. Dropsical conditions depending upon liver disease, and when due to pelvic congestion and hepatic disease. So, ascites caused because of liver cirrhosis disturbs the sugar metabolism. Influenza when liver is affected. That is one more condition. When liver is affected in infectious disorders, fever is associated. Think of this remedy. When liver and spleen both are at a fault, think of Carduus Mar. Debility. The hemorrhage is especially connected with the hepatic diseases. That is one important thing one should not forget. Mind, despondency, forgetful, and apathetic. These are three words which are mentioned by Boericke. Despondency, which you can see. Forgetfulness is secondary to the all these disorders, and apathetic. Patient becomes listless. He doesn't want to talk with anyone. Head, there is contractive feeling above the eyebrows. Dull, heavy, stupid with the foul tongue. Vertigo with tendency to fall forward. That is another feature. There is a tendency to fall forward. Burning and pressure in the eyes, nosebleed. So this is a very important remedy for the congestion of the head and nose. Stomach, the taste is bitter. Aversion to salt meat. Appetite small. Tongue is furred. Nausea, retching, vomiting of green acid fluid. Stitches on the left side of stomach near the spleen, like cyanothus. Gallstone disease with enlarged liver. See, very important sentence. Gallstone colic with enlarged liver. Abdomen pain in the region of liver. Left lobe is very sensitive. This is again a characteristic of the Carduus Mar. Left lobe of liver is affected. Fullness and soreness in moist skin. Constipation. Stools are hard, difficult, knotty, alternates with diarrhea. Here it goes close to the nux vomica, but nux is very acute. Carduus is deep acting. Carduus has very deep action. Stools bright yellow, swelling of the gallbladder with painful tenderness, hyperemia of the liver with jaundice, cirrhosis with dropsy. See, very important feature, cirrhosis with dropsy, generalized edema, not only the ascites associated with the dropsy. Rectum hemorrhagic piles, prolapse or rectum, burning pain in anus and rectum, hard knotting, clay stools, profuse diarrhea due to the rectal cancer, 10 drops doses explained by Wappler. So this remedy is having an action so deep, cirrhosis, degeneration, stone formation, rectal cancer. You'll find the miasmatic focus is psychosyphilitic. It is cancer miasm. Urine is cloudy, golden color. Chest stitching pain in lower right ribs and front. Worse by moving. was by walking, etc. Asthmatic respiration, pain in chest, going to the upstairs, going to shoulders, back, loins and abdomen with urging to urinate. The chest, skin symptoms, itching on lying down at night, varicose ulcers, clematis vitilba, that is another remedy mentioned for varicose ulcer, eruptions on the lower part of the sternum. Extremities, pain in hip joints, spreading throughout the buttocks, down the thighs, worse from stooping, difficult rising, weakness felt in feet, especially after sitting. Relationship, compare Carduus benedictus, strong action on eyes, sensation of contraction in many parts, stomach symptoms are similar. Chelidonium, Ceonanthus, Merck, Podophyllum, Bryonia, aloes, having very specific action on liver. That's why he has tried to explain the correlation between these remedies and the Carduus Mar. You must compare them. Dose, tincture and lower potencies. But generally, I used to use tincture whenever the liver is at fault or cirrhosis is there associated with the ascites. But when it is gallstone colic, it is always better to use it in 30 to 200 in repeated doses. It controls that colic. So this is my aspect of looking towards the remedy, and it is very, very, very useful for these two pathologies. First is liver cirrhosis with ascites, and second important is the gallstone colic. So yes, Satyanarayan sir, what's your question?
Sir, when the ascites is there, the abdomen is full of water. Some accumulated proteins or something, some water is there. When the urine is coming, whether it will be white or in some other color, sir. It will go, some you told golden yellow, something like this.
Yes, this is basically drained away. Ascites is drained, it is absorbed and again passed through the kidneys. So this has been thrown away through the kidneys only. Draining is always generally, ascites is drained with the kidneys only. And urine, why it is golden color? Because there is a jaundice, icterus is there. So golden yellow color is because of that. But when it starts draining, then it never becomes golden. It generally becomes white at that time. When it works as a diuretic. Here it works as a diuretic in such types of ascites cases, and because of which it can drain, and then golden yellow color becomes faint, or so many times it becomes white when it works, if it is the right remedy.
Thank you, sir.
Okay.
Sir, can I ask one question?
Yeah.
Sir, for galactolog, increasing lactation, which medicine works the best in mother tincture?
I have
Lactusa,
not used the
virosa.
mother tincture. I used to use asafoetida. I have never failed with asafoetida in 30th potency, repeated doses.
We can it, sir, continuously for 1 week.
Yeah, definitely you can.
Okay, okay. Thank you, sir.
Okay. So thank you being there. We'll meet again tomorrow with some other remedy. We'll go on in this manner as time permits, definitely with all those things. So thank you and good night.